Good morning. Today our topic is on risk factors for periodontal disease. So, in simple terms, what do you mean by risk? Risk is a possibility of something bad happening. For example, if you didn't study well in your exam, there's a risk of scoring very less mark, or even chances of failure are very high, right? So, risk is not a positive word, but it is also a negative word too. So we can see risk factors in every aspects of our life. In every word, in each and every moment, those are risk factors are there. So risk factors we can see in our profession, medical situations, dental treatment, etc. So the there are some risk factors which are also seen in the periodontal disease. So what is the need to study about all these risk factors? Why we have to study all this? So, the risk assessment that helps the dental professionals to predict the potential for developing the periodontal disease and allow them to focus on early identification and to provide a proactive targeted treatment in periodontitis patient. So, what is periodontitis basically? It is basically the inflammation of supporting structures of teeth. So if no intervention is done, the disease will develop into advanced periodontitis, which can cause complete destruction of the tooth's bony support structure, and eventually it leads to the tooth loss. Even if we cannot remove or reduce all risk factors, periodontal disease or prevention or control we can enhance that. So if we can remove or reduce some of a patient's risk factors, it will be very much useful for our treatment plan. Identifying a patient's risk, counting up the number of factors, and giving added weight to the contribution of diabetics, melters, smoking, etc. So we can discuss more about risk factor. First, we have to know what is a risk factor. So risk factor may be environmental, behavior, or biological in nature that when present, that increases the chances of a disease. This can be included like poor oral hygiene, pathogenic microflora, tobacco smoking, physiological stress. All this can come under this risk factors. Okay. So, and these risk factors are modifiable. So, it is also known as modifiable risk factors. Next is this risk determinant. What is risk determinant? It is, as the name suggests, it is a factor that cannot be modified. It is a determinant factor. It is very much, we can say some person is very much determined, right? So it is very determined factor. Example, genetic factor, gender, etc. That is a determinant factor. Next is the risk indicators. In perio literatures and articles, there are so many types of studies are conducting. So basically, the risk indicator is a probable risk factor, which is identified through the cross-sectional studies. Okay. And next one is the risk marker. This marker can be used, that is the markers, or that is the factors that we can use to predict the future course of a disease. That is a risk marker. Example, if a patient having a previous history of periodontal disease or bleeding on probing, there's a more chances of getting periodontal destruction in future. That is the risk marker. Next is the, we are going to deal with the modifiable risk factor and non-modifiable risk factor. As I mentioned earlier, risk factors that can also be can be modifiable. So some risk factors that are not modifiable, they are called risk determinants. Okay, hope you remember that. Risk determinant is that factors that cannot be modified. That is example, gender, age, sex, etc. Okay, modifiable are environmental factors. So we can come into detail. Modifiable risk factor like oral hygiene and pathogenic microflora. So oral hygiene is like bacteria species including P. gingivalis, Actinomycetum comitans, bacteria forsythia. All these are responsible for the evasion of host response and periodontal breakdown. So the reduction of this pathogenic load can improve the health. So this can be considered as a modifiable risk factor because we can modify that factor. Next is one of the examples is tobacco smoking. So many studies saying that the periodontal risk is more and periodontal breakdown is more common in smoking patient. So we can, we can modify that factor, that will definitely help or reflect in our treatment plan. Diabetes mellitus, as we all know, it is a bidirectional relationship. Next is non-modifiable risk factor that we can't do anything. It is a determinant risk factor. First one, genetic. Genetic factors is a very strong association with our periodontal disease. Interleukin 1, TNF alpha, gene polymorphism having a strong association with the periodontal disease. So many genetic disorders like Zodiac-Hibashi syndrome, phagocytic hemostasis, then abnormal phagocytic chemotaxis, Ehlers-Danlos, Papillon-Leefman syndrome, all these can be connected with as a non-modifiable risk factor. Then next is the host response. So what do you mean by host response? The etiopathogenesis of periodontal disease suggests that most of the tissue destruction caused by the microbial interaction, it is primarily due to the host-derived chemical mediators. So certain individuals show an abnormal host response to a microbial challenge. Okay, and this altered host response is a not modifiable risk factor. Age, as we all know, is a non-modifiable risk factor, and we can see more periodontal loss of attachment in elderly individual than younger individual. Male, gender in gender case, male having a more comparatively more periodontal attachment loss compared to female. That is mainly purely due to the ignorance of oral hygiene. Next is socioeconomic status. So the reason behind socioeconomic status that if the patient having a better education level, definitely that patient having a more accessible to oral hygiene services for people having a good economic status. So that is only connected with the social economic status. Next is stress. It is another risk factor. So stress or anxious patients are mostly neglected their oral hygiene that deteriorate their periodontal health. So severe cortisol level also has an immune response and release of pro-inflammatory mediators in non-inflammatory, that can be seen in the non-modifiable risk factor. Next, we can see the risk indicators. So first one we can tell as osteoporosis. So what is osteoporosis? Osteoporosis is the decreased density of the bone. This is the normal bone structure. This is the decreased density. So it is positively associated with the periodontal disease. Postmenopausal osteoporosis in females is important risk factor that is associated with the severity of the disease. And decreased level of estrogen production is associated with the periodontal disease. Then HIV, as we all know, it is the immunosuppression condition. So in that condition, there is an increased susceptibility of disease. So if a patient is HIV positive, there is a more chance that periodontal disease or gingival disease get worsened, even more than the normal destruction. That is about the HIV. Then infrequent dental visit. Adhering to the periodontal maintenance protocol is a very beneficial for each and every patient. So increased risk for severe periodontitis in patients who had not visited their dentist for more than 3 to 4 years. Next is the risk markers. So what do you know about the risk markers? If a patient having a previous history of periodontal disease, that definitely there will be a chance of increased destruction, right? So if a patient who have a good periodontal status, having also a low risk in future. Then BOP. BOP is bleeding and throbbing. It is the first clinical indicator of gingival inflammation and is the first sign of clinical inflammation. Definitely it indicates the presence of inflammation. So next we are going to deal with the clinical assessment. Clinical assessment can be done on patient level, whole mouth level, tooth level, site level, etc. So first we are patient history. So case history is very much important in this aspect. So patient history, we have to identify the patients for any hereditary diseases, medical conditions, past dental history, smoking, and bruxism. Bruxism means it is an excessive teeth grinding. It's an oral parafunctional activity and it is unrelated to the normal functioning such as eating or talking. Then we have to do the mouth level risk assessment. So examination of attachment loss that is related to the age, occlusal examination of static relationship, occlusal examination level of oral hygiene status, gingival tissue, all these can be assessed in the tooth level. So individual tooth level, we have to assess the anatomy of the tooth, mobility status, support of the tooth structures, percussion involvement, subgingival status of the teeth, etc. We have to assess. And individual site level, we have to check for the bleeding and throbbing, then separations, root concavities, root grooves, etc. So root grooves like labiogingival groove, it is a congenital morphological dental anatomy, which is in the infolding of the inner enamel epithelium and Hertwig's epithelial root sheath. Okay, it is a groove extending from varying depth into the root. So epithelial attach can be breached by gingival irritation secondary to this plaque formation. Okay, this is the site level assessment. So coming to the summary, as we all know, risk factors play a very important role in the etiopathogens of periodontal disease. A reduction of the elimination of a risk factor should be included in the treatment protocol designed for a particular patient. And the periodontal maintenance should be planned taking into consideration of all the risk factors, risk determinants, etc. So that's all about today's class, risk factors. Hope you hope you understand about this. Thank you.